A recent national report in Health Affairs revealed big financial challenges at hospital systems nationwide. Labor shortages, inflation are combining with an end to COVID relief funds to send many systems into the red. New at 6, we learned Ballad Health isn't immune after talking with the regional system CEO. Ballad Health's financials turned south recently. The hospital system lost almost $10 million during the July through September quarter.
You don't have to look any further than our quarterly results to see that there's a concern. And it's clear as to what's happening.
CEO Alan Levine said even though Ballad reduced inefficiencies after its 2018 creation, inflation and raises meant to reduce staff turnover have hit hard.
Before COVID, our total cash flow was $250 million. So we've spent half of our free cash flow on wage increases for nursing, respiratory therapy, lab techs.
But that spending came when federal money was rolling in to offset COVID losses.
Because when you had all that relief money come in and it flowed to the bottom line, everybody said, oh my gosh, look how much money the hospitals are making this year. Well, but that's not what was happening. That money was to help offset losses from the previous 2 years.
Now a 4% Medicare reimbursement cut could be coming even as inflation drives up expenses. Levine says averting the cut would not solve all the Medicare issues.
Inflation doesn't catch up in the Medicare reimbursement for hospitals for 3 years. So do we have 3 years of this that we can sustain this? And the answer is no.
Levine said tense times are ahead between insurance companies and hospitals, as well as struggles for non-urban hospitals particularly.
The insurance companies are not going to want to pay 1 penny more than they have to, and the hospitals are going to want to extract every dime out of them that they can, particularly since Medicare is not paying for its share.
Levine said he and Ballad's board are focusing on solutions, but he said the financial challenges are just beginning.
I don't think we have an expense problem right now. I think we have more of a per unit revenue problem, and that's what we've got to focus on. I think this is an important enough issue that people need to understand the context and need to understand this is a 2 to 4 year problem. And this isn't going to go away overnight.
Levine says he's hopeful Ballad is on the verge of decreasing travel nurse expenses that skyrocketed during the pandemic. Ballad spent $149 million on travel nurses last fiscal year, nearly double the amount of 2021, almost triple 2020's total. Want more details on the system's finances in our web story? You can go to WJHL.com.